Now, the Western Cape believes it can procure its own COVID-19 vaccines by August. The province has set aside 75 million rand from its health budget to do so. About 60% of healthcare workers in the province have already been inoculated. The provincial government says it has the capacity to vaccinate around 36,000 people a day. Let's discuss this with Premier Alan Winde. Premier, thanks for your time. We appreciate it. So how far are you in actually securing these vaccines for the province?
So I actually had a briefing today from the procurement team. We've set up a team of health procurement specialists as well as treasury procurement people. The report that I got back today was that we've engaged with 28 manufacturers or wholesalers or suppliers. Of the 28, 13 have come back in the first round of engagement, of which 5 look fairly promising, so they are further engaging with those 5. As you said, we've already made budget available of 75 million as an initial budget amount, and we've got an 800 million rand contingency allowance for general contingencies in fighting COVID-19 in our total budget of 2.7 billion that we've put aside this year for COVID-19, and that's of course, across the board, from beds to oxygen to whatever else that we need. We're keeping our nursing staff, extra nursing staff in place. We've still got all of the extra beds in place. And so now, yes, it's the vaccine rollout is the next stage, and we've agreed that we will purchase top-up so we get as many people vaccinated and to herd immunity as quickly as possible.
We heard from the minister yesterday that South Africa has secured 51 million doses. You reckon that's on track, or is this your backup plan if that doesn't happen?
Yes, we've got to have a backup plan. I don't believe in always putting all your eggs into one basket. And even that 51 million, remember, they're not all single doses. So some of them are double doses, especially the one from Pfizer. So we are still short. We also note that at SAPRA for approval, there's further vaccines in the process for approval. Of course, we are trying to procure product that's in the approved space, because it doesn't make sense procuring something that's not going to be approved via SAPRA. So it's encouraging to see there's some more vaccines coming through or have been applied. And of course, that broadens our ability to then, in the procurement space, ask more manufacturers or suppliers. And, we've got to try to get that immunity as quickly as possible. I'm also just waiting for the exact numbers that we will be getting as a province as the 2 various vaccines arrive, because they also have to be dealt with differently in the rollout. Some of them need different cold chains, some are 2 doses, some are 1 doses. So how do we roll that out across the province in the most efficient way?
Yeah. And then just in terms of your current numbers and, of course, the threat of a 3rd wave, how is that looking? How are you planning?
So the numbers at the moment, I'm still quite encouraged. We definitely saw a decline in trauma cases over the weekend. We definitely saw a decline in road crashes over the weekend. So immensely grateful and thanks to the citizens for playing their part. And in the numbers as well, obviously we watch it very closely. We call them bushfires. When any numbers start to grow, we look for the cause. We put out that fire. So far, in actual fact, in the last few days, the numbers have continued to come down. And so far, so good. But we'll really only have an idea whether there was an impact from movement or congregation of the Easter weekend. We'll only really have an idea when we get the numbers from next week, so we can measure the 7-day rolling average.
Do you reckon any of the healthcare workers are benefiting from the vaccinations they received? Are you seeing numbers decline when it comes to healthcare workers being infected?
So definitely in our infected healthcare workers, we're right down. We're at numbers that we had sort of only a year ago last. So that's really encouraging. So, I mean, it's anecdotal. We've got low infection numbers in the province as well. But, of course, healthcare workers are on the front line. It's not as if we've got no one infected at the moment. We've still got 756 patients across our health sector, both private and public. So those healthcare workers are in the front line, still treating patients, but the infection number is down. So it's really, it's early days, but a very encouraging sign that the vaccinations are having effect.